I was invited to be a guest on the Outring Tinnitus Podcast and watch this video to hear my in-depth analysis on the best treatments for tinnitus, how to identify the root cause, and some practical tools that you can use in your everyday life. Here we go.
So hello and welcome back to the Outring Tinnitus Podcast. This is Frida and I'm your host, and this podcast is all about the tinnitus science and how to get real and lasting relief from the ringing, buzzing, hissing, or whatever your tinnitus does. I'm very, very glad and happy to be joined here by a guest who was previously on the podcast. We have Dr. Ben from the US today with us. A lot has happened since we recorded the first episode. So 20 million views later, a massive YouTube channel, a big telehealth company. Very exciting stuff that you're sharing with us today.
Yeah, and Frieder, the problem in the United States, at least, is that the average tinnitus patient goes to an ENT doctor and the doctor determines there's no medication or surgery to help the patient. So they tell the patient something like, sorry, you have tinnitus, there's not much I can do for you, or there's not much you can do about it, or even worse, sorry, there's no cure, you're stuck with it, you have to just manage it. And that can actually elicit, as you know, this stress, anxiety, negative feedback loop, making tinnitus worse and sending someone's brain into this fear, fight or flight response where they can honestly get stuck in for a period of weeks or even months. So it is a serious problem that we need to educate doctors and individuals about what is tinnitus, what exactly should happen with the diagnosis, and what are the viable evidence-based treatment strategies.
My first question to you is basically, if we have an accurate diagnosis of tinnitus, what are the first steps to ascertain that diagnosis, basically? So if the ENT says there's not much we can do, I can tell you my perspective afterwards, but from your perspective, what are the first steps? What do people first do when they come to your clinic or to your telehealth clinic? And what are the first steps that you guys take?
Great question. I believe the first step for most patients is to get a hearing test and have the ears medically evaluated or looked at. And that rules out simple things like earwax, ear infections, severe hearing loss, etc. Research has shown that 90% of people with tinnitus have some degree of hearing loss. So to determine that, we need to measure your hearing, and that's where a hearing test comes in. I would say the most important step in the early stages of tinnitus is understand, number one, is there a hearing loss? Are we treating just tinnitus by itself, or are we treating tinnitus with the consideration that the patient has a hearing loss? Oftentimes the low-hanging fruit for tinnitus treatment, or the easy opportunity to get the quickest gains, is by treating hearing loss. So that's what we want to look at first. Frieder, what's your hearing status? I'm curious how your hearing is doing these days. I know I've learned about it in the past, but wanted to bring your case into it a bit.
Yeah, thanks, man. You and most of the listeners know that I was born deaf on my left ear. My mom had an infection during pregnancy, and therefore my left ear has never really worked. And my right ear basically stopped working as well when I was clubbing a lot. So since 19, for 15 years now, I have a tinnitus that progressively got worse as well. And I also wear a hearing aid, and I have a funny combination I can show you. But now this is a hearing aid from a German audiologist where we fit a little bit of a different, not a dome anymore, but literally like a closed, I'm not really sure how to describe it in English, to be honest, but
it's considered a custom ear mold.
Yeah, a custom ear mold. There we go. Exactly. And that is something where, from an audiological perspective, I know that there's also differences in what people sort of like get to their patients. I do fully agree that you say the biggest gains for someone with maybe some mild to moderate hearing loss in the higher frequencies, and that might be also where their tinnitus is coming from, or might at least be exacerbating it. That brings a very big portion of the piece already in, which is the second aspect, which I would like to ask you about as well, to really work with the emotional problems that come with tinnitus. So most people really have sleeplessness, they have insomnia related to tinnitus, they experience constant anxiety, they're in this constant loop of fight or flight. But how do you guys address that second part of tinnitus within your telehealth clinic?
I'd like to share a helpful tool for tinnitus. It's called the Tinnitus Quiz. It's important because it helps specify next steps for your treatment or management of tinnitus based on some answers that you provide through the assessment. You can learn more by clicking the link right there or going to tinnitusquiz.com to take the free assessment. Well, I'll first go back to the principles of tinnitus retraining therapy. And what's fascinating is that over the last years, I've interviewed most of the prominent researchers in the tinnitus and audiology space, spanning from the United States to Europe. Some of the researchers that wrote my textbooks when I was in audiology school. And speaking to them, a lot of the fundamental knowledge of tinnitus treatment in the last 20, 25 years comes from Dr. Jastreboff's research into what is the model of tinnitus, which essentially found that there's a sound component and there's a mental and emotional component to bothersome tinnitus. And it sounds simple, and maybe most people would agree with that today. But speaking with all these experts that have been in the field for many decades, it was clear that that research was an important part in setting the future for tinnitus treatment and basically how professionals would take care of the patients. To answer your question, if we look at tinnitus treatment, there's two main components. One is the sound treatment, of which you had shown your hearing device, right? So that's the sound treatment, and hearing aids can be part of that, as well as sound therapy and some other forms, but the sound treatment is an important pillar to retrain the brain and lower the tinnitus over time. The other important pillar, just as important, according to this model, which is referred to as the neurophysiological model of tinnitus, the other important pillar, same level of importance, is the pathway through the mental and emotional system. If someone has significant tinnitus, but they've trained their amygdala, the emotional response, the hyper attention on tinnitus, if they train that part to be very, very low, then tinnitus is less of a problem in their life. They can do things like they can read a book on a couch in a quiet room. They can go to sleep in the evening without the constant ringing keeping them up at night. They can concentrate and work on their computer during the day without needing a bunch of noise in the background. So both of these pillars are really important, and the mental emotional pathway, essentially what we're doing here is we're changing the filter mechanism of the brain, which can reduce our awareness of sound. And this is referred to as habituation. So even though it's agreed upon now, just a few decades ago, we didn't have this model of using habituation for tinnitus. Patients were just told, hey, you have to, occasionally use sound masking, and that's all we have. But in more recent decades and years, we have psychological based models for how to help tinnitus, and then we have more comprehensive programs which include the psychological element plus the sound treatment. For someone who has bothersome tinnitus, the brain is categorizing it as something important, something that's a threat, something potentially dangerous, something to pay attention to. Sound therapy is one of the most successful tools when used consistently in a treatment period, that if you present a sound, let's take white noise as an example. If you present white noise at a level that's softer than your tinnitus, what you're doing is you are showing the brain that a constant sound is actually neutral. It's not threatening. It's not causing harm. It's not a real danger. So we're impressing upon the brain that this false alarm of tinnitus is a false alarm. It's not a real alarm. So the consistent sound over typically between 6 and 12 months for someone going through a significant treatment with tinnitus, that sound is played underneath the tinnitus during the treatment period. And over that time, patients have better success with reducing their baseline level of tinnitus. So by the end of it, they don't need to use sound therapy anymore, and their baseline tinnitus is often lower. We can measure that with the awareness of tinnitus. What percentage of waking hours are you aware of the sound? We can also measure that with the subjective volume from 1 to 10. Most commonly, patients would start in our program, let's say around a 6, and then after a treatment period, they would explain, oh, my tinnitus is about 50% better. They may say, now it's a 2 or a 3. So sound therapy is one of the tools that promotes neuroplasticity. Tinnitus is often neurological, therefore brain plasticity can happen, and sound therapy is one of the most effective methods and historically proven methods to work for patients. And that's different than masking, where you completely cover your tinnitus. And for those who are trying to learn the details, there are some nuances. So completely covering your tinnitus is not what we're doing. Using it just to distract yourself so you can, quote, forget about the sound, that's not what we're doing. We're trying to promote this neuroplastic change of the auditory brain, which over time can reduce the tinnitus, and that helps people get back to living their life. So that's the overall summary.
Ben, I wanted to ask you one thing. So if people are listening to this and they are struggling and they have a big difficulty, what is an easy step to, find some resources, find some relief, find something online that is pointing towards your resources? I know that I always put some in the show notes as well. So guide some people towards what you guys do for tinnitus relief.
Yeah, for individuals who live in the United States who want a comprehensive treatment program, tinnitus retraining therapy, the fundamentals of cognitive behavioral therapy. I've personally hired a team of excellent doctors on our team at Treble Health, and you can find us at treblehealth.com. You can book a free call with us to discuss your specific case. We do provide a root cause ID where we assess the various root causes that can be contributing to your condition and recommend a treatment plan accordingly. Most of the treatment we do provide via telehealth. Occasionally, we will refer to another medical specialist for some diagnostic testing or specific kinds of treatment. So definitely reach out to us, and yeah, thanks for the offer.
Yeah, absolutely. I mean, I've always been looking up to you also from a YouTube perspective. I think you do fantastic work. And, when I was 19 and I had this big difficulty and there was a lot of shame involved, because I damaged my one remaining good ear. And that was a very difficult time for me. So not really having many resources out there. I remember listening to some ASMR videos and stuff like that to calm me down. And this was kind of like my treatment approach back then. I think there's a world of difference. So it is really, really important that we have people like you.
There's a lot of people that really need help. There's a lot of disappointment from the medical community regarding tinnitus for our patients. So we need you, we need me, we need many others to really make a difference. And that's what we're trying to do.
Yeah. Awesome. Ben, is there something, a last statement, some last words for the listeners out there that you want to give to them today on the second episode having you on the show here?
Absolutely. What I've learned over the years is that tinnitus can improve much more than people think. And as I go deeper and deeper into my profession, I am amazed at how people can turn their tinnitus around, even when some other doctors might say there's not much you can do or it's permanent. In reality, majority of times things can get significantly better. So if I can change anyone's belief on my tinnitus won't get better, things are kind of stuck where they are, I would just ask someone to be open to considering that that might not be true. And if that might not be true, then what can you do as an individual to maybe get 10% better in the next few months, maybe 30% better in the next few months? That's the kind of strategy that gets people into a better place with tinnitus. Compare that to what most people currently do, which is kind of believe that where they're at is where they're going to be, and there's not much out there that can help them. So that's my message, and I just hope everyone stays healthy, takes care of themselves, gets good sleep, feels better in their body, in their ears, and related to tinnitus, as well as hearing conditions like sound sensitivity, hyperacusis, and hearing loss as well. So, Frieder, I really appreciate the invite, and it's good to catch up with you. I hope to talk to you soon.
Yeah, thanks, Ben, and we'll surely have you back on the podcast in the future. Thank you very much, and until next time. Thanks, Ben.
If you like help for tinnitus and want to take our free assessment, you can head over to tinnitusquiz.com or click the link right here on the screen. If you need help of understanding what is the root cause and what can you do, that's the best place to go. This is Dr. Ben with Treble Health saying see you soon.